Hello and welcome to your health channel. Your channel for great and important health tips. Today we are focusing on understanding the symptoms, causes, and cure for depression. Depression is a pervasive mental health condition that affects millions globally, yet it often goes unrecognized or untreated. In this video, we'll explore the common symptoms of depression, delve into its underlying causes, and discuss proactive measures for prevention. Let's shine a light on this important topic to foster greater awareness and support for those grappling with depression. Recognizing the symptoms or signs of depression will help in nipping this menace in the bud. Let's dive into some of these signs. Persistent sadness or low mood. Feeling sad or down most of the time, lasting for weeks or months, is a hallmark symptom of depression. Loss of interest or pleasure in activities. A diminished interest in activities once enjoyed, including hobbies, socializing, or work, is a common indicator of depression. Changes in appetite or weight. Significant changes in appetite, resulting in weight loss or gain, can accompany depressive episodes. Sleep disturbances, insomnia or excessive sleeping, along with other disruptions in sleep patterns, are prevalent among individuals with depression. Fatigue or loss of energy. Feeling persistently tired, lethargic, or lacking energy, even after adequate rest, is a characteristic symptom of depression. Feelings of worthlessness or guilt. Experiencing intense feelings of worthlessness, guilt, or self-blame, disproportionate to the situation, is common in depression. Difficulty concentrating or making decisions. Cognitive impairment, such as difficulty concentrating, remembering details, or making decisions, is often reported by individuals with depression. Psychomotor agitation or retardation. Observable changes in physical movement, including restlessness or slowed speech and gestures, can accompany depression. Irritability or anger outbursts. Increased irritability, frustration, or sudden outbursts of anger may manifest as symptoms of depression, especially in men and adolescents. Physical aches and pains. Unexplained physical symptoms, such as headaches, stomach aches, or muscle pain, can be indicative of underlying depression. Social withdrawal or isolation. Withdrawing from social interactions, avoiding friends, family, or usual activities, is a common behavioral symptom of depression. Thoughts of death or suicide. Persistent thoughts of death, dying, or suicidal ideation are serious indicators of depression and require immediate attention. Difficulty with relationships. Strained interpersonal relationships, conflicts with family or friends, may be a consequence of depressive symptoms such as irritability or withdrawal. Decreased productivity. A decline in work or academic performance, increased absenteeism, or procrastination may result from the cognitive and motivational effects of depression. Feelings of hopelessness or despair. Overwhelming feelings of hopelessness, despair, or a sense that life is devoid of meaning are core features of depressive episodes. Before we proceed, if you find this video helpful, please hit the subscribe, like and notification button and don't forget to share. Thanks for subscribing to this channel. Understanding the causes of depression. A good understanding of causes of depression will go a long way in dealing with it. Let's dive into some of these causes. Unrealistic goals and failed expectations. Setting unrealistic goals, too much concern for material possessions, too many expectations not met, or prolonged delays in achieving goals. Psychological factors. Past trauma, unresolved conflicts, negative thought patterns, and low self-esteem can predispose individuals to depression. Environmental stressor. Stressful life events, such as loss of a loved one, financial difficulties, job loss, or relationship problems, can trigger or exacerbate depressive episodes. Chronic illness or pain. Dealing with chronic health conditions, persistent pain, or disabilities can lead to feelings of hopelessness and contribute to depression. Substance abuse. Substance abuse, including alcohol, drugs, or prescription medications, can worsen depressive symptoms or trigger depressive episodes. Family history. A family history of depression or other mood disorders increases the likelihood of experiencing depression due to genetic and environmental factors. Social isolation. Lack of social support, loneliness, or social stigma surrounding mental health issues can exacerbate feelings of isolation and depression. Traumatic experiences. Physical, emotional, or sexual abuse, as well as neglect or significant life changes, can result in trauma that predisposes individuals to depression. Cognitive distortions. Distorted thinking patterns, such as negative self-talk, catastrophizing, or all-or-nothing thinking, contribute to the maintenance of depressive symptoms. Hormonal changes. Hormonal fluctuations during puberty, pregnancy, menstruation, or menopause can impact mood regulation and increase vulnerability to depression. Seasonal factors. Seasonal affective disorder, SAD, characterized by depressive symptoms that occur seasonally, is linked to reduced exposure to sunlight and disrupted circadian rhythms. Cultural and societal influences. Cultural attitudes toward mental health, gender roles, peer pressure, socioeconomic disparities, and systemic inequalities can shape individual experiences of depression. Personality traits. Certain personality traits, such as neuroticism or perfectionism, may predispose individuals to depression by influencing coping styles and interpersonal relationships. Lack of social support. Inadequate social networks or strained relationships with family and friends contribute to feelings of loneliness and exacerbate depressive symptoms. Stressful life events. Major life stressor, such as divorce, job loss, relocation, or financial difficulties, can overwhelm coping resources and precipitate depressive episodes. Let's take a look at prevention and cure for depression. Are you or someone you know suffering from depression and looking for how to overcome it? Look no further. Take these actionable steps and see the difference it will make. Do not keep quiet. Seeking help and support is a sign of strength, and no one has to face depression alone. Talk to someone close about it. A problem shared is half solved. Seek professional help. Don't hesitate to reach out to a therapist, counselor, or psychiatrist for support and guidance. Therapy, medication, or a combination of both can be effective in treating depression. Building resilience. Strengthening resilience through social support, problem-solving skills, and positive coping strategies buffers against the impact of stressor and reduces vulnerability to depression. Healthy lifestyle choices. Encouraging regular exercise, balanced nutrition, adequate sleep, and avoidance of substance abuse supports overall mental and physical well-being, reducing the risk of depression. Stress management techniques. Practice relaxation techniques such as deep breathing, meditation, or progressive muscle relaxation to reduce stress levels and promote emotional well-being. Maintain social connections. Foster supportive relationships with friends and family. Stay connected through regular communication, social activities, and meaningful interactions. Set realistic goals. Break tasks into smaller, manageable steps and set achievable goals for yourself. Celebrate your accomplishments, no matter how small. Lower expectations and live one day at a time. Practice mindfulness. Cultivate mindfulness through practices such as meditation, mindfulness-based stress reduction, MBSR, or mindful walking. Focus on the present moment and observe your thoughts and feelings without judgment. Engage in meaningful activities. Pursue hobbies, interests, and activities that bring you joy and fulfillment. Engaging in creative outlets, volunteering, or spending time in nature can lift your spirits. Challenge negative thinking. Identify and challenge negative thought patterns. Replace self-critical or pessimistic thoughts with more balanced and realistic ones. Establish routine. Create a daily routine that includes regular meal times, exercise, self-care activities, and sufficient rest. Structure can provide a sense of stability and predictability. Limit screen time. Reduce exposure to negative news or social media that may contribute to feelings of anxiety or inadequacy. Set boundaries around screen time and prioritize activities that nourish your well-being. Express yourself creatively. Explore creative outlets such as art, music, writing, or gardening. Creative expression can be therapeutic and help process emotions. Practice self-compassion. Be kind and compassionate toward yourself. Treat yourself with the same empathy and understanding you would offer to a friend facing similar challenges. Remember that overcoming depression takes time and effort, and it's okay to ask for help along the way. You're not alone, remember. Seeking help and support is a sign of strength, and no one has to face depression alone. Thank you for joining us today, and don't forget to subscribe to this channel for more health tips.